Hello, let's talk today about RLS, Restless Leg Syndrome. This common problem affects approximately 3 to 10% of the population, including patients with Parkinson's disease. My name is Dr. Sayas. I am an internist and a neurologist specialized in movement disorders. Let me start saying that for patients with this condition, RLS, sometimes it's difficult for them to describe what they feel. Many times I hear the word crawling, stretching, pulling leg sensation, and many others. The key here is that this unpleasant, because it's unpleasant sensation, decrease or goes away when they move, when they walk. And also they have this necessity to move, this urge to move. Also, symptoms are worse at night, at least during the beginning, and affecting the legs, at least during the beginning, because sometimes it gets worse and it might affect also the arms as well. Now that you know how we make the diagnosis, and assuming that you don't have other conditions that can mimic RLS, such as neuropathy, muscle cramps, muscle pain, the first step in the management is to make sure that you do not have iron deficiency anemia causing this problem. Okay, this is a very common thing, so make sure that you tell your doctor, because most likely she or he will be checking for iron deficiency anemia. Okay, this is step number one. Step number two, lifestyle modification. Lifestyle modification, such as try to decrease the amount of caffeine, avoid antihistaminic medications such as Benadryl, hydroxine. All these medication, especially the antihistaminic medication that cause sedation, might exacerbate RLS. Other type of medication is antidepressants. Many antidepressants might cause this problem as well. If you ask me which antidepressant is the less likely to cause RLS, is Bupropion or Wellbutrin. Bupropion. This is the less likely to cause this problem. Anything that block dopamine, such as all this medication that you see here, might also cause RLS. Now, the third step before going to the step number 4, which is pharmacological treatment, is things like massage, leg massage at night, acupuncture. There is something, there are some data behind this, is a pneumatic compression. This pneumatic compression that you see here, that you can actually get this on Amazon. Good to try always. It's very safe. It's not a pill, so you always try. Now, step number 4, always try to apply evidence-based guideline. And in this case, I'm talking about the American Academy of Neurology guidelines for RLS. These guidelines were published in 2016. However, the treatment should always be individualized. So every patient is different. Every patient is unique. So you always need to ask yourself, are these symptoms severe enough to affect your function, your quality of life, including your sleep? If the answer is yes, then treat RLS. Otherwise, don't treat that. Okay, that's the first question. Is this problem affecting your life? And if you say yes, then treat. But always remember to take in consideration your comorbidities. When I say comorbidities, I mean the other disease that you have around you. Okay, the cost of the medication. So the prices are different. If you are pregnant or not. So it is a factor. Now let's talk about pharmacological treatment. Medication that we have available to treat RLS. The first choice is long-acting gabapentin. I'm talking about this medication that you see here, Horizant. So the problem with this medication is the cost. So everything depends on your medical insurance. If your medical insurance approves this, then this is the medication to use. This is the medication I will use first. If we cannot use this medication, then we will use something similar, which is Pregabalin or Lyrica, which is pretty effective as well. The third choice will be just regular gabapentin, the short-acting. These three medications that they have the same mechanism of action, they are very well tolerated by the majority of the patient, and the risk of having what we call augmentation is very low. What is augmentation? Augmentation means when the symptoms progress, get worse. Symptoms now are affecting your arms, affecting you during the day, not just at night. So it's pretty bad. And it's highly associated with dopaminergic agents such as levodopa, the medication I will use for Parkinson, and also especially dopamine agonist, like this medication that we have here, Pramipexole, Ropinirole, and Rotigotine, which is the patch, the patch, dopamine agonist patch that we have available. But more commonly, you see that when patients are taking levodopa. This is why these type of medications are not typically the first choice currently in 2023. Sometimes we use dopamine agonists as a first choice, but again, everything depends on the comorbidities. So every patient use is unique, okay? So if you want to know more about the side effect of dopamine agonist, the link is in the description of this video. In summary, after replacing iron, if you have deficiency anemia, you replace iron, right, with vitamin C to improve that absorption. Then you try medications. Medications, the first choice would be the gabapentin, long-acting, or gabapentin, regular gabapentin, or the Lyrica, Pregabalin. That's the first choices, right? The first three choices. If those medication doesn't work, then I will use dopamine agonist as a second choice. And if that doesn't work, then the third choice would be the use of long-acting opioid, long-acting narcotics, like this medication that you see here, oxycodone and methadone. I can count with my hand the patient that I have on this medication for severe RLS. By the way, the side effects from long-acting opioids in this particular population are extremely rare, but certainly is a concern, including the risk of addiction. If you like this video, don't forget to subscribe to my channel. See you soon.